Hear me. The news day continues here on One News Now. I'm Riza Diaz. Despite the modified ECQ status, Cebu continues to record soaring COVID-19 infections. To give us more details, Gemma Vansenia is reporting to us on the ground. Gem, what's the latest COVID-19 tally there?
Riza, active cases of COVID-19 across Cebu are rapidly increasing with 1,111 new cases recorded as of yesterday. The total number of active cases here is now almost 11,000. This morning, we observed a number of quarantine violators along Cebu City's main streets. Many do not observe physical distancing and some are not wearing their face shields and face masks properly. In a press conference, the Cebu City Police said arrested protocol violators increased by 25% since the implementation of the Modified Enhanced Community Quarantine or MECQ on August 1. Most of the people who had been apprehended violated curfew hours and were not wearing their face masks. Many Cebuanos are calling on the government to elevate quarantine restrictions, especially now that hospitals, isolation facilities, and even crematoriums are in full capacity. But Cebu Governor Gwen Garcia appealed to the Interagency Task Force for a downgrade instead, saying that the province economy has to remain open. Garcia said this is so that thousands of jobs, particularly from the tourism sector, will not be affected. Riza, Cebu City LGU opened its mega stay-in facility this morning. This isolation facility could accommodate up to 150 asymptomatic COVID-19 patients. Riza?
Thank you for that update and stay safe. That's Gemma Vansenia reporting live from Cebu City. Now, over 20,000 quarantine violators have been recorded since the reimposition of the enhanced community quarantine in the National Capital Region. Since Friday, the PNP has apprehended, fined, and warned 20,511 citizens for violations of public health and safety guidelines in the NCR Plus bubble. Out of the 20,511, only violators from Metro Manila were sued, while the capital region posted the highest number of violators with 4,394, some 5,700 of which were sanctioned over violations of the uniform curfew hours being implemented, while over 14,700 were cited for violations of minimum public health standards. Meanwhile, the distribution of 10.8 billion pesos in cash assistance or ayuda among residents of Metro Manila will begin the middle of this week. Interior Undersecretary Eduardo Año said necessary preparations have to be put in place before payouts are made in accordance with prevailing health protocols. LGUs are given 15 days initially to complete the distribution of the cash assistance, but this may be extended upon the request. The DILG noted that individuals who receive ayuda in the last two payouts would still be eligible to receive the latest assistance if they are still in areas under ECQ. Now, as the economy continues to reopen, the U.S. workforce may soon have to leave the comforts of their homes for office work. Now, most Americans, however, are willing to make sacrifices to continue the remote work setup. More details in this Bloomberg video.
Finally, one more thought. Let's make a deal. Workers around the country are coming to terms, slowly, with the need to come back to the office as employers coax them back or just plain say they have to come back.
If you can go to a restaurant in New York City, you can come into the office. And we want you in the office.
But it turns out that for a whole lot of us, we sort of like the idea of working from home if we could. Eliminating those long commutes and having the flexibility to fit our personal life around the office rather than the other way around. Some employers may insist people come back in person, and some workers may just refuse, although the work-from-home camp may be able to delay their sacrifices for a few more months, as the list of companies delaying plans to bring workers back to physical offices is growing.
We had plans in place post-Labor Day to be more encouraging about our office environment and trying to get people to encourage them to come back. The Delta variant has changed all that.
The corporate office is beginning to come back in September, then more in November, more in December, and we're checking and adjusting along the way.
But in between is where a negotiation may be taking place. After all, there's always a price for everything, right? And some surveys are starting to set the market price in the bid and the ask for returning to the office. The insurance company Breeze did an online survey showing 2/3 of those whose jobs could be done from home would accept a pay cut of 5%. And another survey done by Pollfish pointed to 15% of people who were willing to take a much deeper cut, as much as a quarter of their pay or all of their paid time off. But maybe the most disturbing result was what else people would give up to work from home. Giving up Netflix or social media for a year isn't so shocking. It could do some of us some good after all. But more troubling is the third of respondents who said that they would give up the right to vote in all future national and local elections if they could just work from home forever. So I'll leave it up to you to think about whether that's more about the pain of community or about how deeply we are discounting our role in choosing our leaders.
Now, people living with HIV are said to be at higher risk for severe COVID-19 infections. With this in mind, should they be prioritized for vaccinations? The World Health Organization answers that in this interview.
Hello and welcome to Science in 5. I'm Vismita Gupta-Smith and these are WHO's Conversations in Science. We are talking to Dr. Meg Doherty today about COVID-19 and how it impacts people living with HIV. Welcome, Meg. Let's start, Meg, with COVID-19 and the risk that it poses to people living with HIV.
Thank you for that really important question. And we are becoming more aware and are following the data, and it's now very much confirmed that people living with HIV have an increased risk for severe disease from COVID, as well as hospitalizations, and then once hospitalized, have a 30% increased risk of death. So this is quite an important new statistic that we are taking seriously at WHO, but also something that now helps countries and people around the world to think about prioritizing both testing and treatment and management of hypertension and diabetes among people living with HIV. This is also really important because we know in the last couple of years, during the COVID pandemic, we have seen reduction in access to prevention services, testing services for HIV, and these kinds of services are the ones that we need to restart and maintain so that all people living with HIV have access to the antiretrovirals they need, they find out if they're living with HIV, and also now start to be prioritized and have access to COVID-19 vaccines.
Meg, should people living with HIV be prioritized for vaccinations?
Considering that people living with HIV have a 30% increased risk of death if they are hospitalized, and that we know vaccination for COVID protects people from both having severe disease and hospitalization and death, absolutely, people living with HIV should be prioritized. For early COVID vaccines, we at WHO have been looking at the vaccines to see if they're safe among people living with HIV, and all vaccines currently right now on the market can be used among people living with HIV and certainly should provide adequate protection. There are many studies looking at whether people who have low immunity or people who have immunosuppression need to have another dose of vaccine. And those data are not yet clear, and we'll be looking forward to knowing whether people living with HIV might need a booster shot in the future. But what we know right now is most of the world in the low and middle income countries in Africa that has the highest burden of HIV, they don't even have the first vaccine. So certainly we urgently need to start vaccinating people around the world and putting people living with HIV right up there in the line of people who need vaccines, along with people with comorbidities, who are older, who are frontline workers.
Now, for more updates, visit News 5, the Philippine Star, and Business World Online. You may also visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.
One PH. Opo, 1 PH. Yung kanya naman